So this final talk is by Dr. Lee, who is a research fellow with Lions Outback Vision, and the title of his talk is Addressing Ocular Trauma Through Improved Understanding of Epidemiology and Culturally Appropriate Health Promotion. If you look at ocular trauma, it's globally a leading cause of blindness and has an immense impact on quality of life, so it's an important talk. In Australia, First Nations people do suffer from higher than average numbers when it comes to eye trauma incidents, hospitalization and morbidity, which is a huge personal and financial burden on patients and their communities. This project aims to research the drivers of eye trauma in Australia and subsequently develop a culturally appropriate, evidence-based local prevention campaign for rural communities in Western Australia. If you could please welcome Dr. Lee.
Cool, thanks a lot, Kaiba. So my name's Qiang. I'm one of the doctors at Lions Outback Vision, and today I have this wonderful opportunity to tell you all about eye trauma. I want to just start by acknowledging the traditional custodians of the lands, skies and waterways of not only Noongar country but also throughout Australia. I want to acknowledge all Aboriginal and Torres Strait Islanders, particularly those who are here today and those who have fought to close the gap in visual outcomes. So, as mentioned, the topic of my talk is on eye injuries. I want to start by giving a bit of a global picture. And this is a fact that surprised me a lot, but eye injuries are actually the single biggest cause of blindness in one eye in the world. Every year, 55 million eye injuries occur globally, resulting in 19 million people who are left with permanent blindness or low vision in one eye, and 4 million people who are left with permanent blindness or low vision in both eyes. So combined, that's pretty much the population of Australia. If you want to look at it another way, as a direct consequence of eye injury, every year an entire country of people are left seeing their world like this, or potentially worse, like this. So clearly, it's a pretty big problem to address. In terms of the specific situation in Australia, over 10,000 people are hospitalised each year for treatment of serious eye injuries, and of these, 2,000 are First Nations, which is 20%, keeping in mind that less than 4% of the total population is First Nations. So this is a huge over-representation. In terms of what the situation is in WA specifically, we actually have some of the highest hospitalisation rates in the country. So this is a particularly pronounced problem in the remote regions. For example, in the Kimberley, 3.2 out of 1,000 people are hospitalised each year for eye injuries. Compare that to the non-First Nations national average, which is 0.79. So it's more than 4 times the prevalence. Not only are First Nations patients 2.8 times more likely to have eye injury in the first place, they're also 3 times more likely to have delays to care, which means they have worse outcomes. This means that overall, the First Nations demographic is incredibly vulnerable to the devastating personal and socio-economic consequences of eye trauma. They have increased morbidity, increased anxiety, depression, poorer vision. They have increased mortality, and there's also a huge financial burden of about $2 billion to the Australian economy each year. It's important to note that First Nations patients aren't the only vulnerable ones. There are also other vulnerable demographics to eye injury. These include children, both First and non-First Nations children, who account for up to 60% of eye injuries, as well as young adults. And we know that for young females, assault is quite a big problem, especially in remote communities. So domestic violence is another domain that's worth addressing. So I'd like to emphasise it's not all bad news. There is a silver lining, which is that 90% of eye injuries are preventable, which means that all of this pain and suffering is potentially avoidable. There has been research into this previously, and the consensus is that, broadly speaking, there are 3 successful strategies to explore. These include eye health promotion, for which the goal is increased education and awareness. The second one is protective eyewear, and the third one, which is the most effective but least attainable, is legislation. However, even though we have this knowledge, there is some difficulty translating it into practice, and there are a couple barriers. When it comes to eye health promotion and legislation, the problem is that in WA, there's no centralised organisation that actually oversees all of this. And to make things worse, in the 2022 to 26 WA Health Promotion Strategic Framework, they didn't even mention eyes. With regards to protective eyewear, even though we know that these are effective in preventing injury, there's low use, and that's because of things like lack of education, pricing, discomfort, poor visibility, as well as potentially style concerns. Other barriers to more effective prevention include a lack of funding, as well as lack of standardised systems for eye injury data collection. And standardised systems are really important because we need to be able to monitor the effectiveness of our interventions in a way that is objective. So, in terms of what Lions Outback want to do to try and overcome these barriers, we're currently undertaking a project. The aim of this project is to address eye trauma in WA's First Nations population through improved understanding of epidemiology, as well as culturally appropriate health promotion. And we're very glad and grateful that we've been pledged funding from the Perth Eye Foundation to support this cause. Broadly speaking, our project involves 5 steps. We begin by researching and understanding the problem. After that, we will need a good amount of stakeholder engagement, which will allow us to design and then disseminate a prevention campaign. And the whole project wraps up with an analysis of impact, which is crucial. To go into each step in a bit more detail, the first step is understanding the problem. Even though we know that certain demographics, like First Nations patients, are at higher risk of eye injury, it's important to research why this is the case. So we're currently undertaking a systematic review, which essentially looks at all the past research that's ever been done in this field and synthesises it into one paper for publication. This review will allow us to not only identify the most vulnerable demographics, but also the common settings and the common mechanisms for eye injury. And ultimately, the outcome of this review is it will help us to provide an evidence base for subsequent campaign design. Step 2 involves stakeholder engagement. Because there are a bunch of existing health promotion services in WA, what we will start in terms of the big picture is identifying and engaging these services. That way we avoid a duplication of resources and instead build on what's already there. So as I mentioned, on top of First Nations patients being vulnerable, kids as well as people who play sport, young adults at risk of interpersonal violence are also target populations. So a couple organisations that we will seek to reach out to include KidSafe, SunSmart, Sports Medicine Australia, as well as Love Bites, Respectful Relationships. In terms of the actual campaign design, our goal is to design a campaign, a pilot campaign, which can be disseminated in the goldfields. And the reason we've chosen the goldfields is they've got a high incidence of eye injury, but we also have a good pre-existing network there that we can leverage off. We will do ongoing stakeholder engagement as part of the campaign design, but instead of being a big picture one, we will emphasise more local stakeholder engagement, which will include services like BIGA, as well as other stakeholders, schools and daycares, sporting communities, healthcare providers, and potentially eye injury survivors who will help us from a consumer engagement perspective. The aim will be to co-design a culturally appropriate eye injury prevention campaign, which we will roll out in the Goldfields, and the specific objectives will be to improve health promotion and education on the burden of eye injuries, how to prevent eye injuries, as well as the importance of seeking care promptly if you do suffer from an eye injury. Moving on to campaign dissemination, as mentioned, we'll make the most of our pre-existing relationships and networks, and we will enlist the help of a digital media company. They will help us to create a series of simple promotional materials which we will disseminate via social media, print, as well as potentially radio and video format. One of the goals of the campaign will be to educate patients on the importance of eye protection. In order to support this behavioural modification, we will also partner with protective eyewear providers such as SafeStyle. And SafeStyle is quite an interesting one. It's actually a WA-based company founded by a tradie who wanted to make glasses which were not only safe but also stylish. And Lions Outback are very grateful to have a pre-existing relationship with these guys. And they've actually had a recent initiative whereby they donate $5 for every pair of these glasses sold. As mentioned, the final step of this whole project will be analysis of impact. It will be very important for us to develop an ethically appropriate framework for evaluation, and the evaluation itself will involve a quantitative and a qualitative aspect, whereby essentially we will survey how effective our campaign has been in changing knowledge, attitudes and behaviour relating to prevention, as well as potentially whether the campaign has had any effect in reducing the amount of eye injuries happening and also promoting earlier presentation for care. In the longer term, we hope that this pilot campaign will have the potential to encourage expanded eye health promotion efforts in WA, as well as funding on a larger scale. And we believe that feeding back to WA Department of Health may pave the way potentially for support from the top down. So in summary, Lions Outback is currently performing research to identify demographic risk factors as well as drivers of eye injury in WA. We'll subsequently engage stakeholders to co-design an evidence-based and culturally appropriate prevention campaign in the Goldfields, and we hope that validation of this initial pilot campaign will spur larger scale health promotion efforts throughout WA. Thank you very much, and I'd be delighted to answer any questions.
What sort of legislation were you thinking about?
So I think legislation is probably the most effective of the three in terms of preventing eye injury, but it's the least attainable in that in order to influence legislation, you need to first show that something works. So I think, in terms of the initial steps of our project, what we'll try to do is focus on the other two domains. We'll focus on increasing education, potentially integrating educational programs into pre-existing health promotion services. We'll try and get increased uptake in terms of use of eye protection in high-risk domains, for example, sport, for example, work. And if we're able to validate the effectiveness of these measures, I think that down the track there's the potential that that may then influence policy and legislation.
Your SafeStyle
Yeah. Yeah, so he is a very attractive fella. He's actually an ex-AFL footballer who played for West Coast and an artist, and he designed those glasses himself. In terms of the other point that you mentioned, you're right, sport and domestic violence, they are two big domains. But as I said, eye trauma, it actually occurs mostly in children, up to 59%. And for children, the biggest place that it occurs is home. So I think what we can do is potentially partner with providers like SafeStyle and encourage parents to get their kids to wear glasses when they're doing high-risk activities, for example, in the backyard. And I think that would be a decent starting point in terms of where these glasses fit into the picture. SafeStyle themselves, they don't have the widest range of sport glasses per se. They do offer them, but I think there's potential to collaborate with other optical dispensers to see if we can get more use of sports glasses in high-risk settings like squash, for example. And lastly, when it comes to domestic violence, that's probably the most complex of all the issues that I've mentioned today. Obviously, it's not going to be something as simple as trying to get, at-risk women wearing glasses in a high-risk environment. It's going to be a lot more involved than that, and it may even be a case of supporting primary prevention, but also secondary prevention. So there may be opportunities to educate healthcare providers on how to recognise certain patterns of injury, and then they may be provided with the correct referral pathways to support services to try and stop these things from happening again. But yeah, domestic violence is probably the most complex of the issues that we've mentioned today.
Can you just tell me, with the legislative approach being potentially the most effective way, can you give me an example of?
Yeah, so essentially all of these approaches, they fall broadly under the category of primary prevention, which is stopping injuries from happening in the first place. But I guess legislation in itself, it has the potential to not only stop injuries happening, but it has the potential to remove that risk in the first place. So some good historical examples would be, for example, restricting the sale of fireworks in certain countries. It might be the use of laminated windscreens or airbags in cars, which are validated to prevent eye injury. So I guess that's why legislation is the most important. It will be implemented on a systemic level to reduce the risk factors that create an environment for injury in the first place. But in order to influence legislation, you need to firstly validate that something works. Cool. All right, thanks guys.